worked at Jo Brant for 10 years.
I have been here for 15 years. So I've worked here, well, coming up to 6 years.
I've been here about 11 years.
I've been here 25 years plus.
I love working for Jo Brant. I think the big surprise when I came here was how much I loved that it was a community hospital. I'd worked in larger hospitals before, and coming to work in my community and you know, recognizing people that are neighbors or from different things that you're involved in was really heartwarming, and I really like the fact that we're here serving Burlington.
I'd say really the most rewarding parts of being a nurse in general, especially in Emerge, is it's a very satisfying job. You can really see the difference in what you do almost instantly. I can use the analogy of a patient who's got renal colic, so someone who comes in with a kidney stone. They come in agony, they're like can hardly even sit still, and you can get them in, you can treat them, give them something for pain, make them feel comfortable within 5 minutes, and then at the end of that you're like, oh, look, I fixed that person, he feels so much better now.
I'm proud to be an existing long-serving member of the Jo Brant family, and to be a witness to the partnership you know, between our hospital and McMaster University, and I look forward to parking in the new spot soon.
Yeah, when I think of my favorite memories working at Joseph Brant Hospital, I think of all the celebrations and the gatherings that we've done as Allied Health together, because we get together to celebrate weddings or baby showers, and we have potlucks, and I think the time we spend celebrating our successes and just meeting together as a group are the times that I remember fondly working here. I think we have a terrific bunch of people working here at Joseph Brant Hospital, and I think we're very lucky to have that. So it's the people that make the workplace, and those are the memories that I'll always take with me.
Well, two memories actually stick out in my mind over these years. One involving the staff here in the cancer clinic, and the other a patient. With the staff, it was actually when I lost a loved one suddenly overseas, and the staff all rallied around me. They were there at this difficult time, rearranged my schedule, and also brought me a plant in memoriam, which is still alive actually. And so I felt like I had a second family here, and I thought marriage was the only institution where you gain a second family. But coming to Jo Brant has given me an extended family with the cancer clinic staff, who are great. They are so supportive and go above and beyond in care of the patients here, and also supporting each other.
You know, working on the board of directors with the Halt and Work program, which is now called Stride, and this is a program that I served on the board for about 9 years actually, and you know, was able to sort of like be part and parcel of what the struggles were in terms of providing appropriate work tasks out in the community, in the location of the rehab centers. And the other thing about it was also to understand, you know, how the politics work, you know, within these systems, and try to establish, you know, good working relations between the hospital and the community.
I have a very early memory that has stuck with me the whole time I'm here. When I first started, I was here about 5 months, and I had a serious injury which had me off work for 5 months. And I felt horrible that I wasn't able to come and complete my role. But everyone was so accommodating. I had meetings in my home because I couldn't travel to the hospital, and just so accommodating and so welcoming that I really feel I also owe Jo Brant a lot, because it was just really set the tone for me and my career here.
With the patient memory, this was also early in my career here at Jo Brant, where I was asked to consult on this gentleman with a type of lung cancer that progresses very rapidly, a small cell lung cancer, and he had a lot of the disease spread all over, and he was very sick. In fact, short of breath, on oxygen, bedbound, and quite delirious. And we had a discussion. I had a discussion with the family, as this cancer can respond to chemotherapy. It doesn't get cured, but it can respond. But we were taking a chance as he was so sick, and so it could be that if he responded, he could get better for a period of time. But if he didn't, and he could get very sick very fast and have all the toxicity. So the family decided to take a chance, and we decided to treat him. And being a 3-day regimen, we had to come in on a Saturday to give him the treatment. And so once again the team came together, and I thought when I came back on Monday that I would not see him on my active list of patients, but to my surprise and to his family's delight, he was sitting up in bed. He still had oxygen on, but he was coherent and eating breakfast. And after a few weeks, he actually left the hospital. He died 10 months later, but he had good quality of life, had time to do things on his bucket list, mend relationships, and celebrate one last Christmas with his family. So this sticks in my mind, and this is why I think I like to come to work every day. I think we are making maybe a small difference in the lives of these patients going through this devastating illness, but at the same time I learn so much from my patients with their strength and fortitude.